To have the best possible recuperation, it is important that you remain active before the surgery and that you start moving soon afterward. This video will show you the daily progression in your rehabilitation following your surgery. With the help of your nurse, you will gradually raise the head of your bed up to 60 degrees. This will help to decrease any dizziness that you may experience when you are upright. This dizziness is normal and can be caused by being in a lying down position for a prolonged period of time. The nurses may also help you try to sit at the edge of the bed. Also note that the nurse will help you roll in bed every few hours to help avoid soreness that may occur when staying in one position for a prolonged period of time. An incentive spirometer will be used every hour that you are awake to help activate and expand your lungs. Take 10 deep breaths, inhaling into the tube to lift and keep the ball up for a few seconds. This is the day of your first physiotherapy session. Your physiotherapist will assess your condition, perform a few exercises, and aid you in getting out of bed and taking your first steps. You will perform some exercises in bed with your physiotherapist. Following this initial physiotherapy session, these exercises can be repeated hourly. Ankle pumps. Move your feet up and down. In circles clockwise and counterclockwise. Heel slides. Slide your feet towards your body, then return to the starting position. Shoulder flexion. Lift your arms above your head to try and touch the pillow. Complete 10 repetitions of these exercises every hour. Following your surgery, to sit up in bed, you will need to avoid rotation in the spine. This can be done by log rolling. Step 1. Slightly bend your knees. Step 2. With the help of the nursing team and physiotherapist, roll to the side, moving the hips and shoulders at the same time. Step 3. From this position, you will be able to sit upright at the edge of the bed. All of this will be done with the help of 2 healthcare professionals. To do this, use your top hand and bottom elbow to push off on the bed and bring your legs off the edge of the bed. Step 4. In some instances, you may need to scoot forwards in bed to have your feet on the floor. This is done by moving one leg forward at a time with the help of your physiotherapist. You may feel dizzy at this time. It is normal to feel this way, and with more practice, your body will adjust and you will feel less dizzy. Take deep breaths, relax your shoulders, and look straight ahead to help decrease the dizziness. You are now in the right position to attempt standing up. Step 1. Hold onto the physiotherapist's hands. Step 2. Lean slightly forward and push with your legs in order to stand. Avoid bending the back when doing this movement. Now you are ready to take your first steps. In order to get back into bed, you will slowly back up until you feel the bed with the back of your legs. You will then bend at the hips and knees and sit back as far as you can, slowly. This technique should also be used when you would like to sit in a chair. To lie back down from the seated position, you will place your hands on the bed and slowly lower yourself down onto your side while also lifting your legs up into bed. The healthcare professionals will assist you in doing this the first few times as you regain your independence. On your second day, you will attempt walking more frequently, progressing your walking distance each time. It is important to try to get out of bed and walking at least 3 times today. You will also continue using the incentive spirometer and doing your bed exercises throughout the day. Today, you will also start sitting in a chair. This will help you build up your sitting endurance, which is needed for your drive home. In order to sit down in a chair, you will use the same technique as sitting down at the edge of the bed.
It is normal to tolerate only a few minutes of sitting for the first time that you are in the chair. With more practice, you will be able to sit for longer periods of time. To help distract yourself, you can watch a movie, read a book, or have a meal. On your third day, you will continue to work on your walking and your sitting endurance. You will also continue to do your bed exercises and your breathing exercises. It is also on the third day that you will be trying the stairs for the first time. We will practice the stairs in the same way that your stairs are at home. If you have a handrail at home, we will use the handrail on the same side that it is situated at home. If you do not have a handrail, we will attempt the stairs without the handrail.
The physiotherapist will stay close by as you ascend and descend, assisting as needed. On this day, you will also receive a pamphlet from your physiotherapist describing safety and tips for returning home.
Early and frequent mobilization will help you recover faster. The more often that you get out of bed, the more you are able to build up your endurance to physical activity, and you will feel more comfortable to do more throughout the day. Upon returning home, you will be able to return progressively to your daily life activities. We look forward to seeing you in the future and wish you a speedy recovery.